Hello, we're going to do our 360 tour. We've got their tools down here. And we have our Snellen chart. I'm going to go ahead and just wash my hands. And Mr. Patient, could you go ahead and identify yourself with your date of birth and your initials?
8789 JW.
All right, great, thank you. Going to start off the physical assessment today with just checking out your hair. It has a smooth texture with an even distribution. Going to check out your skin on your arms as well as your legs. For the purpose of this exam, you are going to be clothed, but ordinarily you would be in a Johnny, and some of these tests would be happening skin to bare skin, yes. So your skin has a nice smooth texture, a medium thickness. The color is appropriate for your ethnicity, and it is warm and dry throughout. I'm going to go ahead and take a look at your nails. There is no clubbing or abnormalities in the fingernails, and same goes for the toenails. We can leave these off for the duration of the exam.
It's cold.
Okay, are you asking to put them back on?
I am, actually.
Okay, we can do that for now. Okay, looking at your head, I'm just going to palpate your temporal arteries as well as your carotid arteries. Both have an appropriate amplitude with no vibration. I'll go ahead and auscultate those as well. Okay, no bruit. Go ahead and look up for me, please. All right, your neck is symmetrical. Thank you. Going to go ahead and look at your, well, first we're just going to do the sinuses. That all looks great. And I'm just going to check your thyroid. Okay, no abnormalities there. There was no tenderness when I was checking your sinuses?
Nope.
Okay. Going to go ahead and move on to your eyes. Got my pen light here. So looking at your eyes, the sclera looks white. There is no drainage coming out of your eyes, no redness. I'm just going to palpate around the eyelids. No edema, no abnormal findings there. Going to go ahead and use this pen light to check the reaction of your pupils. Look just straight on, please. Okay, both are equal and reactive. You can use the ophthalmoscope to check in your eyes. Look, open your eyes wide for me. All right. The disc looks pretty sharp. Everything looks good in there. I am going to have you just follow my finger. Keep your head straight and just follow my finger with your eyes. Okay, there was no extraocular movement there. We're going to go ahead and just do a vision test with our Snellen chart over there. You can use this eye cover. Put it over one eye. Okay, wonderful. I'm so glad to see that you can read down all those lines. Switch eye. Okay, once again, you can read down the appropriate area, and we have discerned that you have 20/20 vision, sir. That is excellent. gonna go ahead and check your ears. So we are going to use the otoscope for that. The outside of both of your ears looks good. No redness, no drainage. Tympanic membrane is a nice pearly gray. I don't see any fluid in there. No signs of infection. Same thing over here. Using my tuning fork, I'm going to do the Rhine and the Weber test. If you could just tell me, do you hear equally the sound on both ears?
Yes.
Okay, and go ahead and tell me when you stop hearing the sound.
Stop.
Okay. And on this side?
Now.
Okay, so there's no conductive hearing loss there, which is excellent, exactly what we want to see. Gonna go ahead and, we're gonna go ahead and actually inspect your nose, so if you could just lift your head up. Okay, both nares are patent, there is no drainage, there's no redness, everything looks good there. I will go ahead and have you open your mouth. You could say ah for me. You can lift your tongue left, right, up, down. Let me just check in there. Okay, so the mucosa is, moist and pink. No cobblestone throat, no postnasal drip, no cobblestoning, no white spots, nothing like that. And I'm just going to go ahead and check your gag reflex. So just go ahead and gag if you need to.
But
Okay, and could you tell me, what do you smell in the room?
popcorn.
Popcorn. Excellent. I did just make some popcorn right before you came. Gonna go ahead and move on from here. We're gonna do some cardiac stuff. Gonna go ahead and palpate and auscultate some of your pulses. So we already did, the temporal and the carotid. I'm going to go ahead and just do these. All right, so I have palpated all those. The amplitude is great. There's no vibration. I don't hear any bruise throughout. I am going to go ahead and check your capillary refill in both your fingers and your toes. We want to see that this is less than 3 seconds all around. Show good perfusion. Okay, and it is, so that is all within normal limits. I'm going to have you sit back a little bit. Alright, so we're just checking the abdominal aorta, the femoral, the iliac, all of that. And again, we have, no buoys, appropriate amplitude, no vibration. I am going to go ahead and listen to your heart, so you can just continue to sit back for me. Okay, so I hear the S1 and S2 heart sounds. I don't hear any other heart sounds, so that is good. I am going to go ahead and assess your lungs. So I'm going to take a listen in 6 areas on the front as well as 6 areas on the back. All right, and I am going to percuss those areas as well. Right, so there was no areas of dullness there. I am going to use this pulse oximeter to check your blood oxygenation, and that is at 99%, so your body is oxygenating and perfusing well. And we're also just going to kind of back it up a second here to check the JVP. So there is no jugular vein distension, and the JVP is 1 centimeter above the sternal angle. I'm also just going to have you open your mouth real quick, check your jaw. Okay, no abnormalities there. I am going to check for some fremitus. So if you could just say 99.
99, 99.
Okay, and I'm going to kind of check your head, under here, lift up a little bit. Okay, lymph nodes all feel good. No palpable nodes. You can put your arms down. Next, just move these over. Next, I will have you go ahead and lay down. Okay, and just breathe normally. Okay, we've got symmetrical chest expansion, looking at the abdomen. We've got a rounded abdomen, symmetrical, no abnormalities, no discoloration, nothing of that nature. I'm going to go ahead and auscultate for bowel sounds. Vowel sounds are heard through all 4 quadrants. Going to just do some light palpation. Is there any tenderness?
No.
No tenderness. Okay. And with deep palpation, I cannot feel any palpable masses. I'm going to go ahead and percuss the liver and the spleen. All right. There's no areas of dullness there. The liver is about 7 centimeters, which is appropriate. The kidneys are not palpable. The spleen is also not palpable. And then upon percussing the abdomen, no areas of dullness there, so no signs of blockage or anything like that, which is good. You can go ahead and pull your shirt down. I'm going to have you sit up. And I'm going to check back here. CVA. No tenderness. Sir?
No.
No tenderness.
No.
Okay. All right. Next, I'm going to have you stand up. And I'm going to have you tilt your head forward and back, side to side. Going to have you shrug your shoulders. Okay. Arms up. Arms down. Actually, you might want to sit so you're in a better view with the camera. Like you're going to give a big hug. In. Okay. And go ahead and put your arms out. And push up. Push down. Okay, so far all of your range of motion is as expected. And your strength is appropriate. Next, I will have you go like this. Flip your arms over. Wiggle your wrists up and down, in and out. All right. As you're sitting, you're going to kick both knees out. Okay, good. You can stand up. And I will have you kind of bend, touch your toes. Okay, we're going to extend like this. Side to side. Okay. We will have you lay down. All right, lift your feet up and down, knees to your chest, one at a time. Okay, you can flip onto your stomach. And you're gonna lift one leg up at a time, straight leg. Okay, next. Perfect. And you can sit back up. And I'm gonna have you point your toes and flex. And I'm gonna have you roll it in and out. Just the foot though, really. Okay, and I'm gonna have you push on my hands. All right, and pull back. Okay, everything is still looking good. Appropriate strength and range of motion throughout. Go ahead and grab my hands. Okay, and push down and up, and then bend your wrists up. No, other way. Down. Okay, and now close your eyes. Now, am I moving your finger up or down?
Up.
Okay. And on this one, am I moving your finger up or down?
Down.
Okay. And down here?
Up.
Okay. Another foot?
Up.
Okay. Looks great. Now I will have you get up, and I'm going to have you walk forward and walk back.
Can I get a demonstration of that, please?
Yep. You're just going to walk forward and back. Okay, and sit down because before I forget, I just need to check for some bronchophony. So I'm going to just have you say 99.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay.
It went black.
Okay, we're just gonna get this going. Okay, so we're still going there. There was no bronchophony.
Okay.
You can stand back up, and I'm gonna have you walk heel to toe. Just for a couple steps. Cool. Now on your toes for a couple steps. Now on your heels for a couple steps. Okay, you can come sit back down. You're going to take one toe and slide it down and on both legs. And then you're going to do finger to nose. Now, really quick, rapid movements, okay? Great. You can stop there. You can put your arms down. And next, we are going to do some reflexes. So we're going to do the bicep. Okay. Okay, reflexes are all as appropriate. Okay. Now, I want you to tell me if this is a sharp sensation or a dull sensation.
Sharp. Dull.
Okay. And now I want you can open your eyes, smile, frown, clench your jaw. I'm going to have you do a sharp face. Now kind of a dull face. And I would like you to open your mouth and say, ah.
Ah.
You can close now. You're going to close your eyes, and I'm going to draw a letter in your hand. What is the letter?
A.
Okay.
B.
Perfect. Now, I am going to put 3 objects in your hand, so keep your eyes closed. And I'd like you to identify these 3 objects.
A nail. Paperclip. 2 keys and a keychain. A nail.
Okay, great. Thank you. You may open your eyes. Now, can you tell me how you spent your last birthday?
I went on vacation.
Okay. And starting from 100, can you count backwards by 7 for 1 minute?
93, 84. No, 93, 86. No, 93.
You have done an excellent job counting backwards by 7 for 1 minute. Thank you very much. Now, I'm going to give you 4 objects, and it's going to be lamp, picture frame, debit card, and Red Bull.
Okay.
And now count backwards from 20.
19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
And what were those 4 objects again?
Debit card, Red Bull, lamp, and picture frame.
That is excellent. Thank you, Mr. JW. Let's see. I'm going to have you take this piece of paper and follow the instructions on it.
Take paper in left hand, fold in half, and place on the floor.
Okay. Thank you very much. Do you have any final questions for me?
What comes after 93?
86.
Okay.
Do you have any other questions for me?
No.
All right. Great. Thank you.